If you have a child with autism or a toddler showing signs of autism, you probably have heard the term joint attention, and you're probably familiar, whether you're a parent or professional, that kids with autism tend to have poor eye contact. Today, we are talking about joint attention and eye contact with a really renowned professional, Dr. Francesca de Espinosa, who is living and working in the UK, but she is internationally known for her work in the field of verbal behavior and her research knowledge and application skills. She is coming on the show today to talk about what joint attention is, how is it related to autism, how is eye contact related to joint attention, and most importantly, a few practical strategies to help you improve joint attention and eye contact in all kids. So let's get to this really great interview with Dr. Francesca de Espinosa. Okay, Francesca, I am so excited to have you here with us today. Thank you for joining us.
Thank you for having me.
Yeah, I heard you present a number of times, and every time has just been awesome and full of insights. And I've taken a lot of your work and applied it to my work as well. So before we jump into the topic, which is going to be joint attention and eye contact, which are two areas that are just so important to our population, can you quickly tell us how you describe your fall into the autism world? How are you here? Where did you come from?
I think my story is similar to many kind of older generation behavioral clinicians. I started off tutoring a child with autism back in '96. I was a psychology undergraduate. I answered an advert from a parent. It happened to be one of the first probably 10 families in the UK who had decided to teach their daughter with this kind of approach. And of course, they were employing a consultant from the US to come every 3 months, and we would have these kind of long 2 days workshops, and they would update the program and train the students, us. And I just kind of fell in love with what I did, and tutor more kids throughout university is pretty much how I managed to support myself. And then was kind of a rut, because in 1999 in the UK, there were no master's program. The BACB actually didn't really exist. So
no, it didn't exist until about 2000, 2001.
And there wasn't a career path in behavior analysis. In fact, I think we still called it kind of behavior modification. And I was kind of stuck, and I got an offer from my university to do a PhD in developmental cognitive psychology, which really attracted me, because that's always been my main interest, is developmental psychology. But I really enjoyed seeing the changes moment to moment that we were making with the kids. And I was just like, I don't know what I'm going to do. And I was like, I don't really understand how this kind of behavior stuff can reconcile with developmental psychology. It seems like it seems very mechanistic. We're kind of teaching, but we just seem to have to teach more. Whereas the idea is that if you teach, at some point the child can learn the next skill by themselves. And I just couldn't reconcile these two things until someone suggested I read Hank Schlinger's book on the behavioral perspective of childhood development, and I did, and kind of completely changed. It changed my just my whole perspective, and I stuck with ABA. But then I realized it was called ABA and not behavior modification, which was an important distinction, and worked for a LOVAS research site in the UK, the first one. And I really learned to program there according to that model. But it was a fantastic experience. And I'll always be grateful for the training that I received there. It was very precise. then because in the UK there was a lot of demand for these kinds of programs and local authorities were being taken to court, they decided to fund a big clinical study at the University of Southampton. And so at about the age of 25, which was pretty crazy, I was hired to actually lead the clinical program for 22 children with autism. And so I left the Globus site and the UCLA project in London and moved to Southampton in 2001, where I was the sort of clinical leader together with Eric Yar, who was a Norwegian consultant. And just before we were about to start, I was writing the curriculum and I went to hear Vince Corbone. And
yep. Game over.
Oh my God, what am I going to do now? Because I've got, this big task, and luckily I hadn't written the full curriculum, and it really I really struggled, because it's a really hard decision to abandon what you know and you know really well and you're really good at. Like, I was really good at teaching kids at discrete child training.
Right, at the LOVAS, implementing the LOVAS model.
But not just that, just how to program in a certain way. Mm-hmm. It was, an approach that I knew. It was basically very psycholinguistic, and so it was a real struggle. But we did. We rewrote the curriculum, and I went to a whole lot more training with Vince, and we began to mold, this is way before we started, our curriculum to be closer to really a kind of marriage between a developmental approach and verbal behavior, in a way that is probably slightly different from the way that it's typically interpreted in the ABLES or the VB-MAP. We looked straight for methods to achieve generative language, mm-hmm. and social interaction as a reinforcer. And that came from kind of my developmental background. And the fact that I was a young mom, I had my first kid when I was 19. So I knew how to play. I'd always been around kids ever since, I started working sort of summer camps and things like that. So I knew a lot about teaching through games, and the two things seemed to go really well.
Yeah.
And then I did my PhD, and sort of 27 years later, pretty much, I teach advanced verbal behavior in a couple of masters. I inherited the VB course from Mark Sandberg at Penn State. Something I'm very grateful for, and I guess I continue to do what I love. Yeah. My work nowadays, mainly since COVID, has focused on working directly with parents and their little children or older children that have a focused problem. So I see a lot of children with sleep issues, eating selectivity, and they're coming to the clinic here, which you can see.
What country are you in?
I'm in the UK.
You're still in the UK.
I'm still in the UK, but I consult with a lot of Italian colleagues online. Yeah. And I still teach in Italy every couple of months. I still go and do some mentorship and some workshops. But yeah, the families come here once a week for an hour. I teach mom and dad to engage in social routines, how to promote social interaction, and becoming relevant for their child. A lot of the time, the parents contact a lot of they end up sort of almost reducing their interactions with the child because the child doesn't really give a lot back. So it's about kind of reteaching them how to interact in a way that the child starts looking at them, starts seeking them out, starts wanting to be with them, so that they can then guide the interactions in a way that's away from objects and kind of solitary reinforcement and more towards social reinforcement. So they come in for an hour a week. We have targets. They practice those targets. Then they come back the following week. We review them. And that model works really well. These are often families who either don't have a diagnosis because here the waiting lists are very long.
And in the United States, they're very long as well.
Well, yeah, I guess. But sometimes here the families wait until the child is going to school.
Yeah.
So they miss out on just, early intervention completely, or they just don't have the money to have a full team. And so we embed the relevant objectives and the interactions and the games in day-to-day life.
Yep.
And so that's what I really love. And
well, I think we have a ton in common. Just in your little introduction, 1996 is when you replied to your tutoring job. 1996 was when my son Lucas was born. And then we both knew and practiced the Lobos model with Lobos consultants. And we both, my friend flew down to Florida to hear Vince Carbone speak, which was the turning point for me morphing Lucas's program into more of a verbal behavior model way back. And I had Hank Schlenker on the podcast, and we can link that in the show notes. I did do a lecture, I didn't do an interview with Vince Carbone, but I have, many instances where he's mentored me. And I did a solo show because he gave a really great National Autism Conference talk one year. And I took his work, it was on language and expanding to 2-word utterances and beyond. And I took his workshop and gave him credit and basically gave a presentation, and that is in a podcast too. We can link that in the show notes. And now we both work with little kids and their parents and try to get as much movement as possible. But I think it's a really good lead into joint attention and eye contact. So first of all, the burning question, and probably if I ask 10 people what joint attention is, I might get 10 variations of the definition. But from an expert like you, what is your definition of joint attention?
I guess it really depends what lens they're using to look at the interaction segment. So, typically people would look at it can define as kind of the triangulation of gaze between an adult or another person, the child, and a shared event. Okay, so that's kind of, a very, we call it topographical description, right? What it looks like. There's sort of 3 elements involved. There have to be at least 3 elements involved. So something that happens in the environment that captures the child's attention. That's a very simple way of explaining, but I think people will understand that. And because the child's history is that when something unusual happens in the environment, they're quite unsure. So they need to seek information from the person who is most associated with basically information regarding this. You can approach that's okay, or no, right? We move away. So the first thing you have to do as the child, something happens, is you need to engage the attention of that person. Engaging the attention means making sure that person is available to give you that information regarding that event. So you then need to direct that person's attention to what it is that captured your interest, right? So the child will engage in some action. It's generally a point, okay? So they'll look at the parent. So you see this triangle going on. And then they'll direct the parent's attention to the event. That now becomes a shared event because we're both looking at, and the child needs to make sure that the parent is still looking at that. So they look back check what those eyes are. Okay, they're there. And then generally what the parent will do is say, oh yeah, that's a cat. Or yeah, there's a butterfly on that flower. Okay. And so that's what we typically call initiating joint attention.
Okay.
So the child is initiating the shared attention between themselves, the parent, and the event.
Yeah. The classic kind of example that I usually give is like an airplane flying overhead, parent, child standing next to each other. The child notices the airplane, looks up, points, looks over to the parent to show them, hey, that's something unusual. And then the parent can say, oh yeah, that's an airplane or whatever like that. So I know pointing doesn't.
Let me just, the important thing for it to be joint attention, initiate joint attention, is that the child has to look back at the parent and at the object. So there has to be back and forth.
Right. So it's not just the point to the airplane, it's a point and a look and back to the object.
Connecting that gaze to the same event.
Yeah. And with pointing, it's got, like, I heard this described by somebody, and I don't know if it's accurate, but almost imagine like the child imagines the point being like an imaginary line up to the object, but then that joint attention is really, it's not about the point, it's about the looking and going back and forth to the object and the looking. Yeah. And that's that triangular,
that's right.
Two people and an event. And it could be, that it could be, I saw another example of like spilling water on a high chair tray. Mm-hmm. And so a typically developing infant or toddler would look up like, oh, what do we do? Like, even if kids don't have any vocal language, that's the important thing too, is they should not just be splashing in the water and not really seeing if that was okay in some kind of eye gaze, right?
Yeah, so what you're looking for is, anything can be an event that captures the child's interest. It's what the child does after that event that makes the difference between being a social interaction or just exploratory kind of play.
Yeah.
Right? We're thinking about typical development.
Yeah. And what age does joint attention emerge typically? Right.
So children will often engage in sort of precursor type behavior. So social referencing, for example, where they're monitoring the parent's face, again, to gain information regarding maybe a stranger approaching, right? Okay. But they don't have yet the physical mobility to engage in controlling the sort of larger lens. So, but in terms of sort of that kind of the joint attention we've been talking about 9 months, that's when we would be looking at certainly pre-vocalizations. Yeah. Often vocalizations begin or mature a little bit more around that time. Certainly that's when we start seeing the emergence of more listener behavior, receptive language, because the parent is narrating what the child is pointing at. And we can also look at it in terms of demand for information from the child. Like, I want to know what that is. We often see it during story time when, parents look at picture books with their sort of 9-month-old. They'll point to something and the child will follow that point, and then they'll look back at the parent to hear the word. So that's what we would call responding joint attention, because they're responding to the parent pointing. But very soon the reverse happens. The child will see something they recognize or something that's different, and they'll point to it and then look at the parent to hear that word, and then they hear that word, and then they go back. And that's how we start seeing those kind of the emergence of those kind of very, very early sort of receptive discriminations.
Yeah. So I think it might be a good idea now to merge into the eye contact piece of joint attention, because in order to reference somebody's with an eye gaze and look back at an object, whether or not you can physically point with your index finger or not, you might be a reach, it might be a, it might be a sound or something like that. But without that eye gaze, you don't have joint attention, back and forth. So, why do kids with autism who later get diagnosed with autism have lack of eye contact and lack of joint attention? I guess that's the $1 million question.
It is a $1 million question, and luckily I'm not the one who's tried to answer it. I think we can take a very kind of logical and pragmatic view about this. We know that one of the sort of characteristics of children with autism, and it's a characteristic that it lasts a lifetime. It is part of the condition. It is an insensitivity to social stimuli, right? So that's kind of inbuilt. It's not learned. It's something that happens probably in utero. It's genetically inherited. We know that that autism is not the result of any kind of psychological issue as such. But I think it's important to say that these things are set in motion very, very early on. So we're talking from birth. They may not be detectable, but what we do see and what we do know from research, recent sort of neuroscientific research, Amy Glynn is the one who's done fantastic work on this, is that when you compare children who are at risk of developing autism because they may have a sibling who has already been diagnosed, and children who are seemingly not at risk, and you present social stimuli are people, right? That's what we call by social stimuli, right? People who move, people who sing, people who talk, and non-social stimuli. There is a preference for non-social stimuli. And also, they looked at, what is it that the child at risk for autism looks at when social stimuli are presented. And whereas the child who is not going to be diagnosed with autism, the infant, we're talking, 4 to 9 months, so 6, let's say 6 months on average. The typical infant will look at the eyes, and the child who would then move on to be diagnosed with autism typically looks at the mouth and is really looking at, they suggest that whether things happen in sync, but they are less interested in the eyes. So that's interesting. So we know that there's some we also know that there may potentially be some structural anomalies when MRIs have been looked at. So what does all this do? It sort of limits the power of, or the value, if you want to, of social stimuli. By social stimuli, we mean the movements of people. So facial expression is one, voices is another movement, okay? So if you think of a very young infant whose range of motion is completely limited, they can't really move very much. The environment can't really control their movement, but they can move their head. So a young infant can move their head. And we know that even a newborn will preferentially turn to familiar voices compared to unfamiliar voices, right? And the question is why? It's not just a question of familiarity, but behavior happens because it's reinforced, right? So otherwise it wouldn't happen over time. So the question to me is, why is looking important? Why is looking at people, your con-specific? Why is it important? It's a survival skill to begin with, right? Because the only movement the child can make is with the head and with the eyes. And what do parents do when they meet those eyes, right? They provide a lot of social reinforcement. They provide more, their voices change, they provide more physical contact. So very, very early on, the sort of looking recruits a lot of reinforcement, a lot of attention.
Mm-hmm.
That's what we call attention, is being available to provide reinforcement, right? And, the child can only really see 20 to 30 centimeters when they're born. If you think about how you're holding them, what's the one thing that they see the most? The face. It's sort of big, these big white holes it's very, very obvious. And we see this not just in humans, we see this in social animals as well. It's a way of gaining information. If you can't move around the world in the way that, humans are the most dependent species that have the longest period of infancy as any other mammal. Mm-hmm. They cannot survive without the care of a grown-up. Mm-hmm. Right? So very early on, they learn all sorts of ways to gain that attention, that care.
Right.
And one way is to use your eyes.
Right. And I know several times that I've seen you speak, Francesca. It's either been at the ABAI conferences over the years. That's always held Memorial Day weekend, which I've missed several years now. And then the National Autism Conference, which is the Penn State conference, where you are a frequent, every year kind of lecturer. And so is Ami Klin. Dr. Ami Klin has been there the past 4 or 5 years in a row. And, when it was online during COVID. And he is a big reason for my more recent work, my newest book, Turn Autism Around, my toddler course. And just like I took Dr. Vince Carbone's lecture from the NAC conference and broke it down into a solo show because it was such valuable information, I did the same thing with a lecture from Dr. Ami Klin, and that we can link in the show notes too. And one of the lectures that I've seen over the years by Dr. Ami Klin in person is this eye contact, also with mouse for sure, but also with, like, he showed this video of 2 toddlers in a plastic wagon with a door that swang open. And, the 6-month-old, 9-month-old, 1-year-old, baby was strapped into a car seat watching these videos, and they were tracking their eye gaze. And the kids that went on to get a diagnosis of autism really were focused on the door swinging back and forth, the movement of the door, the movement of the mouth.
Biological and non-biological movement, the movement of people.
Yeah.
The movement of objects.
Yeah. And he even has now a patented system, it's almost like an MRI, but it's basically a car seat watching videos to track eye gaze. And I mean, he's also done a ton of research on early intervention. That's in chapter 1 of my Turn Autism Around book, some of his research and his findings. And at the end of one of the lectures, he asked for questions, and I said, do you think autism can be prevented? And he said, no, I think the genetic autism cannot be prevented, but I know from the research that speech disorders and behavioral disorders that often accompany autism can be prevented, and in some case reversed or at least remediated. And he does believe, based on his research, that kids can move up the spectrum in many cases from very impaired with those severe language and behavioral disorders to more independent, more conversational, whatever that looks like. I mean, nobody has a crystal ball to look forwards or backwards, but he does do important research.
From early intensive behavioral intervention, I think what Dr. Klin has said is interesting, and I would, agree with him. The way I would look at it is, if we think of autism as primarily a disorder of social reciprocity,
Mhm.
The question is, why? So the eye contact, the reduced eye contact to me is a measurement of the level of how important social stimuli are, how important are people. So if we don't look at it as a core deficit, but as a consequence of reduced social motivation, so reduced, which is, it's not learned, is that probably from birth, then the opportunities to learn through social interaction are going to be much less. And that's why we then see this sort of different developmental trajectory in children with autism. The speech doesn't come, or is very delayed. When it comes, it's very odd. It's mainly in reference to objects rather than, pointing out the actions of people. So early intervention is crucial, and most interventionists, whether they buy into a behavioral approach or not, whether they prefer a more developmental interpretation or not, they all agree that early intervention is crucial. But not, behaviorists often think of it as, the earlier you begin to teach skills. A developmental lens will look at it in a slightly different way, as in, how do we change the value and the function of people so that they become really relevant? And that way, the skills that a typical child will learn through social interaction may not be so diminished in the child with autism, because people will become more relevant. And then the eye contact will come as a result of that, because it then becomes important to look at people, because people are associated with good things that are going to happen. The child learns that by engaging, contacting that person, drawing their attention, then a whole lot of fun things happen afterwards.
Yeah. So totally agree with everything you're saying. Let's give our listeners, because we don't want to get too long here, let's give our listeners, 5 things they can do today to, and I'm just throwing out 5, could be 3, could be 8, could be whatever you want, but like some practical strategies to improve joint attention and eye contact in kids with autism and toddlers showing signs.
Right. So one of the things is really make your face relevant, right? So you're not looking for eye contact, you're looking for orienting. So you're looking for that head to lift a little bit. So how you place yourself is really important, how you position yourself. So let's say, always think, I'm going to try and position myself, if we're playing with objects, in a kind of triangle, right? So there's the set of objects. Let's say that the child, we're playing with balls and we're throwing the balls in a bucket. And then the bucket, once the bucket is full, we tip it over, right? So what I tell parents is think in patterns. Find a rhythm, 3 actions that repeat over and over. So throw the ball. So I pass the ball to the child throws it. I pass the ball to the child throws it. Bucket's full, and I tip it up, child orients up, and then it goes down. So that head lift is reinforced by the natural action, which is the ultimate reinforcer. And all the bits that come before are opportunities to build that kind of interaction. So think of it as a pattern. I call it a pattern game. We can also think of it as a chain. If you really want to be a bit more technical, find your rhythm so that you have that back and forth interaction. That's what an interaction is. It's a series of connections, right? And as you're moving those balls, move them to the right, move them to the left. The child is going to learn to expect that the ball is going to come. So once you the child's put that ball in the bucket, wait, learn to pause. Because if you pause, the child will do something, because he's learned that's the pattern, and they'll turn. And that's when you can then present that ball up and get that orienting towards you, right? So I always tell the parents, let's find 5 pattern games that we can play. where you position yourself, where that ball comes from. If you present it at eye level, child's not going to need to turn. So you're presenting it right there in front of them, right?
Yeah.
If you present it to the side, what's the child going to have to do to reach? Sure.
Right.
So that's what I teach them, to position themselves and to pause.
I like that.
Find the game, find the pattern, think where you are, where you're positioned, and learn to pause, to give the child a chance to do something, to make you move. The child is in control. That's what we need.
Yeah, I love that. And I always tell people to sit catty corner whenever possible. And, not really thinking actually, Francesca, of necessarily that, but also I don't want to be right in front of them. It does naturally make kids turn, orient. We're not looking for eye contact. We're never grabbing somebody's chin and trying to get eye contact. I never work on eye contact directly. You want awareness of your face, of your, yeah, love that. Okay. So that's great. I always recommend cause and effect kind of toys, balls in, hammer and ball, toys with parts, anything that you can be the giver.
Absolutely. Yep. Yeah.
So what's another tip?
Another tip, I guess, is I think parents, what I found mainly through COVID, I sort of, I used to be the kind of clinician, and I've been in this field for so long. I've worked with so many parents, but sometimes, as a clinician, the parents would say, oh, I haven't had time to do that, or something like that. I want to get a little bit, I don't know if annoyed is the right word, but I would get a little bit like demotivated. It's like, well, if you're not going to do this, we can't really expect a lot of change. And then through COVID, I had some parents who were really, really struggling. They may have had I had one family who had twins with autism at home by herself. And I thought, respect to all of them. And I thought, I need to understand the contingencies as to why that parent is not engaging in the tasks that we've agreed. And so my eye kind of turned to the parents and trying to find ways so that they could contact reinforcement with being with their child. And I found that the best way to do it was to embed them in daily routines, things that they were doing anyway, because they had to take care of the child. So they had to get them up, they had to bathe them, they had to dress them, they had to feed them. And I thought, what if we find a game so that the child will start giving something back instead of engaging in stereotypy all the time? And by doing that, reinforce the parents' involvement. Mm-hmm. And so that was the other thing, is look for 2-3 minute interactions. You don't need to run a session for an hour. And clinicians don't need to teach that. 2-3 minute interactions, carefully arranged, parents properly coached, that are embedded in daily life. And what you find is that both the child and the parent look forward to those moments. And when a parent tells you, I couldn't do it, then you take stock and you say, all right, how can I help you to find a way that you can engage in an interaction with your child that you find rewarding? Mm-hmm. And that's what I kind of learned to do. I ate a big piece of humble pie.
Yeah. I know COVID was so hard for so many people, especially during that time. But yeah, I've seen some of the course participants, pull the child's, high chair up or booster seat up, or, have them buy them while they're chopping up vegetables and chop, and like engage them in daily routines. You're chopping up vegetables anyway. So it doesn't have to be, like you said, like a session or anything. You're using the 1 word ×3 strategy. You're embedding, you're being animated. Like you talked about making your face important, like be animated, be, chop, chop, and apple. If the child wants an apple, you're cutting it up. You're going to say the name. Grocery store, same thing. You're saying the names of things. You're engaging your child. Don't expect your child to say it back, even if they can talk or have said the word here or there. Make it fun, make it positive, and don't have your expectations so high that I told you to say apple. Like none of that, because we want the social language and we want the joint attention to go up, right?
Yeah, we do. And I think what I find with both parents and children is if they learn this idea of building a pattern, then they match the words to that pattern. So it may be up, down, boo. And what begins to happen is if you then pause, what some kids, not all, because that event is not coming, that's what they're expecting. And, predictability is a reinforcer for all of us, is then they might approximate it to make you say it.
Yeah.
Because, right? So absolutely accompany your language to the various actions. Don't overwhelm, don't talk too much.
Mm-hmm.
If your child is at 0 vocal approximations, sometimes just sound effects are enough.
Mm-hmm.
Right? So just make it really distinct. That's different from all the noise that they hear around. So, and then single words, right? And then you go 1 word up, depending on where your child is.
Yeah, I love that. Okay. How about one more tip? Anything to improve joint attention and eye contact?
I think I've sort of said most of it.
I think I found something from one of your lectures that I wrote down. Putting things high up on shelves and
yes. So
really having everything.
So sanitize the environment is again the technical term to say it. So what you want for your child to need you, right? That's as simple as I can put it. So you want for your child to come and get you, and it's fine for them to grab your hand, and it's even fine for them to use your arm as an extension of their body, because I would rather they did that than problem solved, as in grabbing a stool, putting it on top of a chair, and then climbing on the shelf. So you want to put it just high enough that they can't help themselves, but not so high that they can't see it. And have the various activities that you're going to be doing there. But the other thing that I guess I want to tell parents is that it's okay sometimes to give them the one thing that they love, that they stim with, and it's perfectly okay, if it gives you a little bit of time for yourself.
Yeah. Yep. Yeah, we totally agree on that. As a parent myself of a son with autism, you do need some relief of it's okay as long as they're safe and they're stimming and they're keeping themselves busy, even if that looks a little odd, or as long as they're not harming themselves. And I love the fact that you said, you want them to need you. So even if they love to spin around or they love to jump on the sofa alone, how can we make it more fun with us in it?
Yeah, absolutely. Yeah.
I mean, we're very in line with these similar procedures, but I think your expertise in the developmental and your psychology background, and I think really has cleared even some of the nuances up for me. So I really appreciate your knowledge and your wisdom in sharing with us today. So before I let you go, all the show notes, everything we talked about today, and those couple other shows that you may want to watch are going to be at marybarbera.com/242. But before I let you go, how can people follow you or learn more about you or even contact you?
Thank you for mentioning that. So I have a website that's abaclinic.net. Is that? Yes, that's the English one. I have an Italian one and an English one. So the English one is abaclinic.net. And I have just given instruction to the web designer to update it. We have some cool stuff coming out, such as like a little mini course for mainly parents and tutors to learn how to chain games, do social patterns. But that's one way of doing it. And then just my Facebook page. I don't post a lot, but if I am giving a talk, then I do generally post it there. So it's just my name, Francesca degli Espinosa. And I'm not very good at self-promotion. I tend to just post it, and if people are interested, and then generally people are.
Well,
so,
a lot of people are interested in your work, and
and the NAC archives. So the NAC, the National Autism Conference, they had this amazing service for the community, giving out all of the, all the talks. Provided the presenters have agreed.
Yeah.
So there's 10 years of my talks on the archives, and at least 2 of them are on early social responding. So
awesome. And speaking of the NAC conference, it happens every year in the first week of August at Penn State University and State College, Pennsylvania, which is pretty close to my house, a couple hours away. I am unfortunately not going to be able to go this year, but I do go some years, and it is an excellent conference. And if you go, definitely check out Francesca's work, because live and in person is amazing, and she shows some really great videos. Okay, final question. Part of my podcast and video goals are not to just help the kids, but help the parents and professionals live happier lives with less stress. So what do you do personally, Francesca, that other parents and professionals might be able to incorporate into their day to be less stressed?
I walk. I walk, and if I'm particularly stressed, I run. I think my suggestion to mainly my students, the sort of really busy professionals, or maybe at the beginning of their career and they feel overwhelmed, is I always ask them, what's one thing that you love that you used to do and you don't do anymore? And it might be, I don't read books anymore. I don't read novels. I only read, papers, or, I used to love, going to concerts, or, and so I asked them, what do you need to do to be able to contact that reinforcer again? And most often than not, we can find some approximation to that target behavior. And so that's what I also tell my parents, is what's the one thing that you used to do that you loved before you had kids? And how can you get a little bit of that back into your life? That's just you, that's just for yourself. So
I love it. Love it.
Yeah.
All right. Well, thank you again for your time. I look forward to seeing you in person again real soon, and wish you all the best with all of your research.
It's been a lot of fun. Thank you.
Thank you for catching up.